Hello everyone, my name is Lutfiana Hanifah from class 1C, student of Radiology Department. Now I will give a little presentation about contrast. Contrast is meant by noise in an image, resulting in a grainy and unclear radiographic image. Next slide, SNR. SNR is the comparison between the information signal and the noise contained in a transmission medium. The number of X-ray photo that hit the receptor or MAS is commonly called signal, and what can be called noise is a negative factor that affects an image. If signal is greater than the noise, then the structure of the soft tissue can be seen clearly. On the other hand, if the signal or MAS is low with high noise, it will produce unclear and grainy. Next slide is high SNR. What the meaning of high SNR? High SNR is the image above is an example of using a high SNR, clearly visible without noise due to the use of adequate exposure factor, which is certainly not excessive, so as not to overexpose the patient. From what I explained earlier, images that are too bright will not be clear in digital processing, so it's best to check first. Next, low SNR. When MES is sufficient, the registers of the receiver does not receive the X-ray it showed, resulting in a low SNR with a noise image. However, if you use monitor with low resolution, the noise will not be visible. So, looking the exposure factor can be a way to influence noise. If the image is with obvious noise, it should be reviewed by a doctor or radiologist whether it should be repeated or not. To minimize this, the radiographer can also use a grid for inspection, especially on the thick body part, and adjust collimation to reduce noise.
Thank you. Wassalamualaikum warahmatullahi wabarakatuh.